we're going to be talking about celiac and gluten sensitivity, and we're going to be talking about how people get diagnosed or undiagnosed for that matter, because many people are, their problem with gluten is being missed because they'll only call people gluten sensitive if they have celiac. These things are two different things. I have other posts that will talk about that in detail, that you can have gluten sensitivity without celiac. But the way mainstream medicine diagnoses celiac is that if you have atrophy or damage to the inside of your intestines. So inside your intestines, where the food is traveling through, they're all lined with these cells, and these cells line up, and when the food molecules get small enough to enter back into the bloodstream as nutrients, then they'll enter back through. So I'm going to blow up one cell for you, and a cell will have villi, or finger-like projections, where it increases the surface area of the intestine so that when food passes through, food will be able, there's more area for the food to be absorbed through. So in celiac disease, you're diagnosed with celiac when these villi, these villus projections, atrophy. They have been damaged from an autoimmune process where the body is literally killing them. So as a result, now you have, instead of a nice shag carpet of villi, finger-like projections to help you absorb nutrients, it's now like a flattened carpet. You no longer do that. There's lots of inflammation, there's damage, there's an autoimmune process going on, and that's what celiac is. The markers that are looked at in typical doctor's offices are things like gliadin, which is a component of gluten. There's transglutaminase enzyme antibodies, gliadin antibodies, and then endomyocele antibodies. These are the components in the blood work that are determined or looked at to determine whether you have celiac. And then the final thing that they're going to look at to determine whether you do is this villus atrophy. Now, they will only diagnose you as celiac if the villus atrophy is complete, if it's severe. Problem is, if it's not severe enough for them to call it celiac, they'll tell you you don't have it, and then people are walking out of offices thinking they can have gluten. These things don't come back positive. Again, if you want more information, I have 3 or 4 other posts so far on these limitation of just looking at these 3 antibodies. But the idea is, without full atrophy, they're not going to call you celiac. So if you're halfway there, no celiac. So when they tell you and quote you studies, and if you ask, well, how accurate is it? They say it's very accurate. We can catch 97% of the people with celiac to have these markers. In other words, these markers are very accurate. So if they're going to come back positive, you have. If they don't come back, you're going to be fine. Not necessarily true, because what the research tells us is that if that quote of 97% or over 90% they're saying they can catch it, they're only including people in there that have complete villus atrophy. So if you have some or halfway and not very severe, they're not going to include you in that statistic. When you do now include all the people in this statistical analysis that have some atrophy, have some inflammation going on in their gut, the accuracy of these detection markers, it goes down to only about 30%, 27 to 32%. So they're missing 60+% of the people that may have gluten sensitivity. And again, they're not going to call it gluten sensitivity. They're just going to call it you don't have celiac. So there are 2 separate things. You can't just use these markers. You have to use other ones. And just realize that you could have not an autoimmune disease going on or an autoimmune process going on and still have gluten sensitivity. So keep this in mind when you're judging whether the information you're getting. So you need a doctor who understands these things. So I hope this information was helpful, and I'd like to thank you for watching, and make it a great day.